Hello, it's Dr. Rhonda Johnson. Today is Sunday, September 10th, 2023, and today I'm giving a COVID update. Now, COVID update is only as good for the day that you're giving it, but data from the CDC COVID-19 data tracker shows that the most recent U.S. data on September 7th shows that hospitalizations are up 15.7% and deaths are up 10.5%. And wastewater sites are showing an uptick across the United States. So what's causing this rise? Well, as of September 2nd, there are many COVID-19 variants in the mix. The EG.5 variant, also known as Eris, is responsible for 21.5% of viruses sequenced. The FL 1.5.1 variant counts for 15.1% of the viruses sequenced in the United States, and then the XBBs pretty much account for the rest. Now, say what about the FL 1.5.1? What is that? You may want to know. It's also called Fornax. It's an XBB variant descendant. It has a mutation in it that helps increase its contagiousness. Now, in terms of symptoms, the experts say that all these variants pretty much cause the same presentation clinically. Cold-like symptoms, muscle aches, sore throats, fatigue. Some people are reporting unusual skin rashes, and some people have fever. So what about the BA.2.86 variant, also known as Parola? I reported on this a little while ago. This is a new lineage that has a highly mutated spike protein on par from an evolutionary sense with the original Omicron variant BA.1. Researchers are watching this one intensely. The good news is that it has not exploded in terms of a number of cases of infections, and experts are saying now that our immune systems will still likely mount a memory response to this Parola variant, at least in the lab where it's been tested. Now, what about the new booster vaccines? Well, the CDC Advisory Committee meets September 12th. Commercialization will occur. This means that there will be less free vaccines, and you'll have to get your vaccine through your private insurer, and there may be some cost sharing. Now, Medicaid, Medicare, and CHIP programs will likely cover the vaccine. Vaccines for Children program, the VFC, will cover eligible VFC children also. Now, there's a new federal program called Bridge Access, which provides for the uninsured and the underinsured adults 19 years and older. Now, doctors and provider offices will have to purchase their supplies of the COVID-19 vaccines. And folks, to be honest, I won't be surprised if there's a little bit of chaos and some unequal access in these COVID-19 vaccines. Now, expect a little bit of controversy over who should get a booster. One physician on the FDA Vaccine Advisory Committee, Dr. Paul Offit, has gone on record saying that he does not think COVID-19 boosters are necessary for middle-aged and younger Americans who do not have chronic diseases. He feels the booster should be targeted to people who are at the highest risk for severe disease and death. And he believes that most people already have enough immunity through prior COVID vaccinations and illnesses to prevent severe disease this winter. Now, another COVID-19 expert disagrees. That's Dr. Eric Topol. And he says younger people should have the ability to make the choice as to whether they would like to have some enhanced protection. So, folks, we'll just have to see how the booster rollout goes. As of today, I can't tell you much. And as always, I advise you to discuss your vaccine decisions with your personal healthcare provider, your doctor, your nurse practitioner, or whoever guides your healthcare. That's my message today. Be safe, folks. Take care and be well.